So I want to bring in David Vlahov. He is a professor of nursing at Yale School of Nursing. David, it is so good to have you with us. Thank you. So I want to ask you, first of all, about this saliva-based COVID test that Bryn was just talking about. We know it was developed at Yale. The fact that the FDA granted this emergency use authorization, seemingly, at least for the public, it seems quick. What kind of validation does that give this test?
Well, it gives it the validation. The FDA requires a number of tests to be done and data to be presented to show that it, is sensitive in picking up the positives and doesn't make a mistake in, picking up negatives. So it passed those tests. It went, through a series of them. So it performs well based on that testing. And the FDA recognizes it as an emergency, that as people have been saying earlier here, is we need to get more testing out there, and we need to get over the obstacles that are in the way to be able to do that large scale. And this test helps in that way.
Is there any concern about people administering this test to themselves at home, and if that could affect the accuracy of the test, or is this going to be pretty simple?
Well, there's saliva tests for, other infections such as HIV that have been done at home. I think what they're starting with here is to have it, as supervised, right? And so, going through and tightening up the protocol to, make sure that it's good. So the opportunity there for the testing is, there's no nasopharyngeal swab. You're putting saliva into a container, and it's easily transportable, and the testing is very straightforward. So it certainly lends itself to that.
Would you consider this then a game changer in the fight here?
Completely a game changer. This is, people don't like having swabs put up their nose. Having healthcare workers in front of people who are infected with them at risk. So that takes care of, this element. It doesn't, require, expensive processing. It's pretty straightforward in that way. So that cuts a lot of costs, makes the supply chain a little bit earlier. The testing here is flexible. It's not just you have to have one machine. It's been tested to be able to look at different kinds of equipment and reagents. So the idea is to make it as widely available based on what equipment people already have in their facilities.
And real quickly, we only have a couple seconds left, but the American Heart Association says that COVID-related heart damage is worse than was originally thought. That just came out in the last couple of days. What is your assessment of that? What does it mean that the heart damage is worse than they thought it would be? What kind of damage are they talking about?
Well, in terms of COVID, we think of it as, initially like the flu, it would be respiratory. And as they've been following patients, they see that people do present with, with heart issues. The enzymes go up, the biomarkers go up as if the person had a heart attack. So that's a serious concern. And the damage is not just during the hospitalization, which 20 to 40% of people who are hospitalized have evidence of heart damage, but this can last beyond the recovery of the acute infection itself. We don't know if it's temporary or if it's going to be permanent, but it's certainly a concern.
Yeah, there's so much about it that we don't know, but we appreciate you taking the time to be with us today. Professor Vlahov, thank you so much for your time this morning and your expertise.
Thank you.